Hello, everyone. Welcome to our first webinar for the Lifestyle Medicine series for 2024. The Lifestyle Medicine program at the Mass General Cancer Center is thrilled to host this six-part webinar series where we will explore strategies to help individuals with a history of cancer improve health and well-being. We are so excited that you have joined us today. Some of you may ask, what is lifestyle medicine? The Lifestyle Medicine program at our cancer center seeks to provide evidence-based lifestyle interventions that have been shown to improve quality of life, alleviate symptoms post-treatment, and promote the adoption of healthy lifestyle behaviors after a diagnosis of cancer. We also provide personalized consultations in our clinic, as well as group visits to help patients achieve these goals. Today's webinar is entitled Spring into Health, where we are going to focus on tips and tricks for goal setting after a cancer diagnosis. After our discussion, there'll be an opportunity for questions, and there's a Q&A box at the bottom of the screen where you're welcome to put questions and comments. I'm thrilled to have this wonderful group of panelists join me today. So I'm going to briefly introduce myself and then turn it over to each of them so they can introduce themselves. So I'm Dr. Amy Comander, and I'm the director of the Lifestyle Medicine program here at the Mass General Cancer Center. I'm also a breast oncologist, and I direct the Mass General Cancer Center in Waltham. This is my passion, doing this type of education, so I'm so thrilled to work with Dr. Ramchandani and these wonderful patient panelists who are going to introduce themselves briefly right after me. So Dr. Ramchandani, why don't you introduce yourself?
Great. Thank you, Amy. So I am Dr. Shalu Ramchandani. I'm an internal medicine physician with a focus on weight management and lifestyle medicine. I also work part-time at the Mass General's Mind Body Medicine Center. And I've had the privilege to work with Amy at the Lifestyle Medicine team at the Cancer Center, where we've been doing these webinars over the last 3 years. This is our third year, so excited about this. And it is a true passion of mine as well to just share any information that we can to help people with healthy behavior change. So with that, I'll let Sherri go next.
Okay. Hey, everybody, it's an honor to be here. Thank you both for Amy and Shalu to include me in this wonderful session. I'm a cancer thriver. I've been told to not use survivor, instead use thriver, and I love that pivot. I was if it's okay, I'll just explain, my health situation, just yes. So that in case other people connect with my journey. But I was diagnosed in January of 21 with breast cancer at a point where we're in the middle of pandemic, so a little memory backlash from the that period of time. We were sort of in a very closed down situation, and so it was kind of startling to me, very inconvenient, quite frankly, to have this diagnosis. But fortunately, they caught it early, and I was able to have radiation as my treatment. And then follow on with the hormone suppressant medication, which has been, my experience now for the last couple of years in dealing with that. And so for me, I was connected, obviously, with Amy through my breast cancer diagnosis and treatment. And then she fortunately connected me with Shalu, and Shalu and I have been working together on my health and wellness and focus in this last year, which has been transformative. And we'll talk about that more later, but that's my story. And I feel great. And, it's really a tribute to the support I've received, which I'm very grateful for. Thank you.
Thank you so much, Sherri. We're so glad you're here. I'm going to turn it over now to Linda. And by the way, we all agreed ahead of time, we're going to do a first name basis to keep this very conversational and interactive. Linda, go ahead.
Hi, everybody. I am Linda Wolf. I am so happy to be here. Thank you for having me, Amy and Shalu. And Sherri, I'm pleased to be here with you too. I am a breast cancer thriver as well, although I don't mind the word survivor either, because I feel like it's a lot to get through cancer and survive it and go on. So my short history is that I was diagnosed in 2018 with ER, PR positive, HER2 negative breast cancer. I went through chemotherapy, a double mastectomy, and radiation. And I am also on, aromatase inhibitors now, and I've had some other medications as well. But I today, cancer-free, knock on wood, very, very healthy. And a lot of that I owe to my medical team. Amy headed that up for me. And also, in addition to the lifestyle medicine program that was just discussed, she has another program called Paving that I was part of, which applies the principles of lifestyle medicine to all aspects of life. And that has been a huge support in my life. And one of those things is one of the 12 things we focus on is purpose. So I'm very, very happy to be here and be able to talk about that and whatever else comes up today. So thanks for having me.
So with that, I guess I'll get started. Last time we did this, Amy and I, it was around New Year's, and we were talking about New Year's resolutions. But I just want to reiterate that we don't have to just set up goals around New Year's, right? Because we should be setting up goals any time of the year. We're continuing to strive for growth and working on positive behavior change. And really, goals can be set at any time of the year. I even think about them like sort of like every week, like every Monday. But spring is always a good time because that's when the weather is getting better. People are getting excited about being outdoors and maybe taking on some new challenges. So with that, I'm going to ask Sherri and Amy some questions around sort of goal setting and how they go about doing things. But I would love to hear first from Sherri just about just challenges that people have. Like I know people do have challenges around goal setting and oftentimes don't even hesitate to even set goals. But do you have any experience around that, Sherri? And I just gonna get your thoughts.
Yes, I do. Coming from an environment, just from a professional environment where goal setting was very much germane to what we do. I'm an HR executive, so that implies that we should be working on goals within the workplace. And so I do address my own personal goal setting sort of in that same framework. And I know you'll talk a little bit more later about SMART goals, which is actually the fundamentals that we use. But for me personally, it's, there's a level of accountability that I try to think about. And what motivates me in goal setting is to feel better. And that's been my journey this last year, has been a goal to feel better, but also looking for anchors around that. And anchors can be, either the personal things that you do for self-management, but also anchoring others around you from the accountability perspective. And so for me, it's a combination of determining what I need to do to feel better, but also surrounding myself with what I think works for me. It may not work for everybody, but I kind of think of it as anchors, accountability for, yourself. And I think you've talked about in other sessions about self-compassion, which I think comes into that accountability. It's not a, oh, you're either successful or not, self-compassion kind of helps you with that. But I think about it in terms of anchor. How do I anchor myself and get on a path to feel better? Because ultimately, that was my goal in engaging in this journey last year with you, Shalu, was all about that.
Yeah, no, thank you, Sherri, for sharing that. So I totally agree. I think there's so much to be said about just connecting with your values and what that ultimate results look like. And like we said earlier, we were chit-chatting about how none of this is a destination, it is all a journey. So it is wonderful to continue to strive toward whatever that better health looks like. But that's great. What about you, Linda? Do you have any thoughts around that? Well, you're on mute, Linda.
I heard you ask what are some of the barriers, and I want to just refer back to when I first was diagnosed, in case there are people here listening who are still going through treatment. for me, goals at the time that well, let me just say before I was diagnosed, I had spent a lot of time setting goals for myself in the personal development realm. And I had done a lot of work on myself mentally, spiritually, emotionally. And I, had gotten to this like really amazing place in my life. But with cancer, it was like a whole new ballpark, whatever field, whatever, and ball game, sorry. And I had to really narrow down what was my focus going to be because I had to get through cancer, and I was determined to survive it. So the barriers to goal setting were like I couldn't think too big. I couldn't put too much on myself, which speaks to the self-compassion. So what I did was I broke it into like the segments of treatment. Like as I faced chemotherapy, what could I do to make that better for myself? And my family supported me, and I just dived in, did all this research, and set goals on like, okay, for this part of the treatment, I'm going to make it better for myself, and maximize the effects by doing these things. And and that's how I kind of got through cancer with goal setting.
So what you're saying is setting kind of short-term goals.
Short-term goals to get through it.
That makes perfect sense, right? Because sometimes if a goal is too large, it's almost intimidating on how are you going to get there. So setting those small incremental goals, small baby steps to those short-term goals is very helpful. Yeah. No, thank you. Amy?
I love that. Thank you both for sharing those really interesting perspectives. I want to follow up on something Sherri mentioned, and Linda, you alluded to this as well. But Sherri, you talked a lot about this concept of these anchors in your life and how you kind of set up accountability when it came to improving your health in various ways. And we know that social connection and social support is such a key aspect of lifestyle medicine and making lifestyle changes. So I was wondering, Sherri and Linda, if you could both share some specific examples of how you set up these anchors, whether it was with your family and friends, whether it was in the group visits you were part of, but we'd love to learn more about that. Sherri, why don't you go first?
Okay. Yeah. And for me, from a timing perspective, it was self-isolating. It just happened to be, at a kind of an interesting time where, in some respects, I've shared this story with others about how I had a therapy session because it's part of your healing and journey. And I remember talking to this gentleman who was wonderful about the fact that I was so disassociated in a bit, because not only the fact that I was, it was at a time where you couldn't even really go into a facility. So I felt like this cancer thing was happening over video. It was kind of this weird, I was like, I have cancer, but it doesn't feel physical. It felt, I don't know, it was hard to explain. But in that isolation, I had people at home. And so what I realized is the importance of having that support system. And that really helped me with these phases, as Linda was describing. You sort of kind of go through these chunks. I mean, it's the nature of it, right? You get your diagnosis, then you have surgery, then you have treatment after. For most people, that's usually the path. And each of those phases, I had people I could talk to and who were just physically around me at a time when you weren't really around other people. And so I think that became then part of where I am now with accountability, is helping, identifying people who are part of your journey, who are supportive, who will do things like meet you at the mall and walk for an hour and have a conversation. And one, you're getting healthy, you're having some, from a physical perspective, you're engaged socially. And then you also have the opportunity, I think, too, for mental health, is I think conversations with people, who are supportive to you, just help you with processing things. And sometimes I would have conversations and say things that I didn't even realize were in my brain, but having someone with you to process it. And it doesn't have to be a family member. And so I found the interesting connection of, you have your family, sort of in one category of how that support looks. And then you have other people who are your friends and associates who help you with that. So to me, that was my experience, and where I just sort of for lack of a better term, stumbled into some of this. I think that's, again, part of the journey, Shalu, you talk about. But I also knew I needed that structure just because of the isolation at that time.
Thank you so much for sharing. And yes, I just have to acknowledge going through all this in 2020, 2021, 2022, so many challenges that, in addition to, as you stated, having a new cancer diagnosis. So I'm so glad you were able to identify these supports, and really sounds like it helped you so much along your journey. Linda, I'd love to hear from you too.
Yes, thank you. Sherri, it's good to hear that. I totally agree with you on social connection. The thing that okay, so I mentioned to you that I had all these goals and purpose before cancer that was kind of in the mental realm. But with cancer, it really hit me physically, obviously. Like, this is my body. How well was I taking care of it? How did this happen? How do I prevent it from happening again? So I really, really got focused on the physical. And the number one motivator was, I don't want to die. I want to live. And like that's like the most powerful motivator of all, because I have a young child. So I want to live anyway, but then I have a young child. So the focus for me on goals at the beginning, once I got through most of the treatment, was how do I make sure that I stay healthy, physically healthy? And the number one thing that I focused on in the beginning was nutrition and diet. What am I eating? What am I putting in my body? Nobody really knows what causes cancer. I mean, there's so many factors. So I just wanted to cover as many as I could. And that was the number one, because I wasn't doing enough, obviously. Well, not obviously, but I felt I could do better. So I really focused on that. And then once I got through that phase of getting things in place, I looked at like everything in my environment. What else can we work on? How do we improve what cleaners we use, what pots and pans we're using, what, plants are in our house? How do we make sure that the environment is as healthy and clean as possible? So I got very physical. My goal setting was very, very focused on the physical.
If I can interject, first of all, thank you, Linda, for sharing that. I think that such an important piece of this is having that objective, right? For you, that objective was, I really want to be healthy. I have this wonderful family. These are your values. And having that sort of as your goal enough is already a motivator. But I want to just challenge you both a little bit on, sometimes we set these goals and we're not always successful, right? Like, say, I want to try to incorporate, 3 to 4 servings of fruits and vegetables every single day in my diet. And by the end of the week, if we're not as successful, sometimes we feel a little bit like either guilty or just shamed, or just kind of, not feeling like you can really do these things. So what are some of the things that were helpful for two of you? And maybe Linda, you can start first on how do you overcome those feelings?
Such a good question, Shalu. And I thought about this ahead of time because I've actually recently been going through some relapse, a time for resetting.
Okay.
And that, like, I've gotten complacent. It's been 5 years for me. And thank God in my medical team and my support system. But I've let it slip, like I'm eating more sweets, and I'm, eating more, generally a little bit more food, like more than I maybe need. And so I've gained some weight. And, the way that I handle it is I become aware, and there was a clear point when I was like, oh, I'm too far over the weight I'm comfortable with. And then, I really have eliminated the beat yourself up stage. So thank goodness I don't do that anymore. And I take the self-compassion that's been mentioned, and I say, okay, this is the way it is right now. Now I need to recommit myself. So it's just recognizing it, being aware, and then deciding what I'm going to do about it, and being kind to myself in that process. So, and it's slow, and I acknowledge that it might not be tomorrow that I'm going to get to where I want to be, but I can start slowly, and whatever I do to cut back on the food or the sweets, or do more exercise, engage my daughter in going for walks with me, getting more active, like I try to do it in a kind way and just get back on track. Because you're right, you can't be perfect in these
And
things.
it's not a destination, right? It's just a journey. Sometimes we go up, sometimes we go back down. But I loved how you said that, because it's true that we don't always achieve everything that we've set up for ourselves. And monitoring yourself is extremely important. So you mentioned weighing yourself. That's an important self-monitoring, having awareness. I think for some people, they do food journaling as a way of becoming more aware of what they're taking in. But also the other point that I was thinking about what you said, I love the fact that, yes, do not beat yourself up, because there are so many things that we do so well that we don't give ourselves credit for, because you may not have, maybe thought about the 2 or 3 days of the week that you did get to those goals. So even if you weren't 100%, you were 50%, and that should be enough to help improve that self-efficacy for you to sort of keep going and building on these goals. And maybe not in the nutrition, maybe in the exercise realm, you would think you were much more successful. And just giving yourself that pat on the back is also so helpful to help you keep going forward. So, but thank you. And Sherri, what are your thoughts on that, on how you cope with setbacks? And
Yeah, well, I think it's a constant sort of internal mental gymnastics at times to think about, when you set goals, you obviously you want to attain those. But first and foremost, I had to do a mental and emotional pivot to focusing on myself. And I think I talked to you a little bit about this in a previous session about it was really a wake up call for me to focus on myself. I'm very much a person who takes care of others. And I'm sure there are a lot of people on this call who are caregivers in many different formats, children, parents, people who are in their sphere of extended family. And so cancer for me was that wake up call to focus on myself. But in the process, wanting to also give myself some grace. And so I was a big believer in, and this again sort of translates from work, but I'm a phaser. So I like to put in phases of let me try this and see if I can get to a cadence of doing this, and then sort of layering in. So I didn't have this sense of, oh, it's all or nothing, and I feel like a failure. So there's definitely that the self-talk piece of it that you have to work on. But I will say sometimes you just need some ice cream. I'm just going to be blunt. Like, I don't know if the rest of you think that way, but
yeah, no,
sometimes I just want ice
absolutely.
cream. So I do negotiate with myself, and I'll say, well, but I have plans this week to really work on my exercise, or this month I'm going, my plan, whatever goal I wrote down, which I do like also want to point out, writing down is very helpful. I have sticky notes. I'm a sticky note person
That
to remind
reminder.
myself.
Yes.
But I will negotiate in my brain, if you're going to have that ice cream, then I'll just make sure I do an extra exercise, because I know that will benefit me. And I know realistically for me, I'm going to have ice cream very often. Life is not over.
Yeah, right.
So I don't know, Linda, if that helps you too, but sometimes, whatever your kryptonite is, chocolate chip cookies, you're just, we're not about eliminating,
Yeah.
things that, we find can be fun and add to it. But we also, I kind of incorporate that into, well, that's some accountability then to ensure that I do these other things, because it's always a balance. Otherwise, you're just beating yourself up. And now that I am focusing a bit more on myself, and trying to think about me first, which is hard at times, that becomes now, an opportunity for me to really try to advance the things that I know I need to do for myself. But it is hard to put myself first, I'll be honest.
And I'm so glad you brought this up, because it brings me to my next point of how all of this really is a balancing act. And if we go from wanting to do 100%, and if that fails and you go back down to 0%, you're not doing yourself any good. So I much rather be that 80%, 20% person that, hey, if I did great for 80% of the week, and if I did have that piece of whatever it was that I ate, that's perfectly fine. and you shouldn't beat yourself up and, regret yourself for doing that. But that's still better than the 100 and 0. So, and the one more point before I hand it over to Amy was, one of the things that I was thinking about was, I don't know if this has helped you both, but sometimes also resetting goals, because sometimes we try to set too many goals, and sometimes they're much bigger than what we're able to attain. So if one was not able to get through some of the goals that they had set for themselves for the week, maybe it's just time to sort of rethink it, right? Maybe the goals were too big, and maybe we start even smaller than that. But anyway, with that, Amy.
Oh, wow. So many great points that have been discussed. Where to start? Just thinking about what you just said, Shalu, it's funny, in one of our recent paving groups, that whole concept came up, like set tiny goals, tiny little goals. And in fact, I do have one of those books right next to me, Tiny Habits by BJ Fogg, like thinking about making tiny changes that you can achieve. And that's a great way to get that positive boost of confidence that I can do this, and not really focus on big lofty goals, as you just noted. But I just love that you made that comment. But anyway, Sherri and Linda, you shared so many interesting points, but I did actually want to ask a question that I thought of that I've heard from some of my own patients, and I didn't ask you guys this ahead of time, so you might have to think for a second. But as you've maybe tried to introduce some healthier habits into your routine, such as perhaps following more of a plant predominant diet, or getting more exercise into your routine, or making time for you to, to pursue some of these goals, did you find any resistance from your family members? So for example, finding that not everyone was on the same page as you making these changes. And if so, how did you address that? I know that's a tough one, sorry. Linda, do you want to go first? And hey, if you didn't encounter any resistance, great. Family members or friends, I should say.
Yeah. I mean, I have to say that I was very lucky, and my family has been incredibly supportive. So when I bring up, well, I mean, that's not to say we always agree on everything, but like when I say to my husband, we need to get new pots, then it becomes like a whole, like, well, researching, well, what about this and what about that? And then, so I'm picking stainless steel, and he's like, I hate stainless steel. The food gets stuck to it. No, we need and I'm like, but I don't know which coated thing works best. And I'm going to ask all my friends. And, so we had that kind of engagement. And then, I was like, well, I'm going to buy all these peace lilies because they take all the chemicals out of the air, so I buy all the plants, but then he has to take care of them because I stink at it. I will kill them, so it's there's a lot of negotiation, but I was lucky that everybody was supportive. I mentioned on one of our pre-calls that my stepson shaved his head in solidarity with me when I lost my hair. And the goal of like feeling supported is always been, my family's always been there for me, but how it gets negotiated might be challenging.
Yeah. Wow. Well, thank you for sharing that. Sherri, I don't know if you experienced anything like that or.
Well, I feel like I need to talk to Linda more about some of the things she's doing for her environmental, because you are way ahead of me on that, and I'm intrigued by it. So I'm glad you're sharing those little bit of tidbits, and I'm making notes. But for me, kind of similar to Linda, I think my biggest change was probably dinner, because dinner is sort of an anchor for our family, and just a difference in how I was now approaching cooking. A lot more vegetables and healthy. And it was a bit of an adjustment from, more of the meat and potatoes style maybe diet that we were doing before. And fortunately, I think for the folks who are in my house, which is my husband and my 20-something son who's still with us, we adapted to that. But I will tell the story, because I told you this earlier, about just in general, the support. My son took me to radiation appointments or radiology appointments, and we use humor in our family. Probably, I don't know that you can necessarily have a lot of humor around cancer, but I will share that he used to call himself my boober, taking me instead of Uber. So I wanted to share that story just from the standpoint of that when all said and done, humor does help us as another emotion in this process. So where I've had some failures on some of the things I've tried to cook, that I thought might be more healthy. We've just all been very humorous about, well, that was a great try, honey, but well, we won't keep that on the regular schedule for food, for dinner. But anyway, so just things like that have helped us, and I have certainly enjoyed the support that I've had, and I feel very fortunate.
That's great. I love the boober.
I was gonna
Yes,
say, yeah.
humor does work.
Yes.
Makes you laugh.
Yeah. Just on that note, I think, all of this it can be stressful, obviously, to receive any diagnoses, and then especially if a diagnosis of cancer, and then having multiple appointments for radiation and chemo, possibly, all of that activates our stress physiology so much. And when we're under that kind of chronic stress, it's very difficult to have that self-regulation. Right. So you have that loss of sort of executive function when people may be resorting to behaviors that they wouldn't normally do. So like lack of exercise, but, reaching for the cookie or reaching for something. And that could be also just part of that activation of that stress physiology that's making you not want to take on positive, healthy behaviors. And humor is actually a great way of relieving that stress. That's been proven, that's evidence-based. So I definitely encourage people to use that. I think that's a wonderful story to share. And along those lines, of course, exercise is, of course, really helpful. But the other thing that made me think earlier when we were talking about accountability and wanting to be with people who, kind of motivate you, right? Having friends who are going to help you to go for walks. I think it's also really nice to be able to find people who are basically modeling already what you want to do, right? So if you have friends, like Amy is a runner, like I thought, gee, if I just start running with her, I'll become a runner. So along those lines, like, having those friends who are already like walkers or already doing the strength training and whatever else that you want to get into, I think it's nice to have that model. But if I could just, talk a little bit more also on self-compassion, I think that is such an important piece of this. We're all so quick to beat ourselves up, like Linda was saying earlier too. But what are some of the tips do you want to share with everyone what you say? What are some words of kindness that you tell yourself in those moments of, when you're trying to show self-compassion? Maybe Sherri, do you want to start with that?
Well, I guess maybe what I'll talk about is my mantra, because I think that helps me, if you don't mind me kind of just interjecting. And
yeah.
Okay, so I don't know if this is going to read that way, but it's my little sticky note, and I don't know if it can be read. But
Why don't you read it?
there's three. Can you see it? It's interesting.
I can't read. Yeah.
Oh, well, it's the words are adapt, adjust, and revise. And why I like this, and this was a podcast that I had listened to right around the time that I was diagnosed, and obviously, and it's from Alan Alda, for those of you who know MASH, and of course, my family, I've already divulged that we like humor, so of course, that was that's a very funny. If you want just to make yourself laugh, there are many sitcoms out there, but that one really resonated. But he talks about this as a life secret for himself. If he could talk to himself when he was in his 50s, this is what he would have said to himself. And it really does resonate. And I put it as a sticky. It was just on my monitor, and I've had it there for now several years. And really, it's if you think about it just in the grander scheme of life, adapt. Adapt, adjust, and revise. And sort of from a mental health perspective, and also for my own sort of self-forgiveness, I guess, is that this is just a constant cycle. And if you put the paradigm of cancer, into this framework, this whole journey, just even this last year with you, Shalu, where I came out of a very sort of dark period of, self flagellation, maybe, whatever. I was just mad at myself. I couldn't get myself going and just needed support. And then just really focused on this, adapt to whatever the change is, make your adjustments around it. And I think it really resonates with goal setting, because I think it lines up nicely sort of in parallel. So you set your goals, but you do have to think about things are going to fly in, adjustments need to be made, something unexpected, or even if it's planned, then you can say, hey, what adjustments do I need to make in my goals? And then you're also in a constant state of revision. And so I use that as my anchor. So I try to not necessarily go to self, recriminations or self, just making it about like, oh, I'm a failure. And look, every day, you're faced with what your plans are and what you're going to do. And, so not every day is perfect, but I did find this to be very helpful. So I thought I would just share that, because I think those are 3 simple words, coming from somebody who has wisdom. And it just really resonated with me. So it's adapt, adjust, revise.
And revise. I love that. I also want to add one more A there, but adapt, you said, right? So accept, how about accept, adapt, adjust, and revise, right?
Ooh, okay, well, I'm adding that. The first one before is accept. I think that's at the beginning.
Yeah, that's the beginning. Yeah. So we're changing, right? Our bodies are changing, things are happening, and we accept. And then, I love it. Thank you.
I'll reach out to Alan Alda and let him know.
And let him know that I said that.
His right advice. So I appreciate it. But that's wonderful. I love that, actually. That does make a difference.
Yeah, no, thank you for sharing that. I love that. I'm going to put that on my little sticky too now. But Linda, I'd love to hear what you say to yourself if you have any tips.
Well, yeah, I mean, I relate to everything Sherri just said, and I love what you added, Shalu, because for me, the work that I keep referencing, like before cancer and through cancer, of personal growth, is based on self-acceptance for me. And having done a lot of work on that, I had a lot of tools to just apply them during cancer. But I think the thing that underlies all my efforts to deal with whatever challenges are coming at me is like being grounded in myself, like knowing that really no matter what happens, I'm going to be okay. Like in having that grounding and having that connection to myself means that I can deal with whatever the challenges are. It's cancer right now. Okay, now but I would summarize it. I didn't say this to myself per se, but this is how I would summarize that concept, which is basically, just for today, I am okay. Okay, so and that comes from a lot of different sources, and it took a long time to kind of like get into my soul, but that's how I operate. So getting cancer, of course, it threw me off. It threw me off for a while. But eventually I was able to re-ground and say, well, just for today, I'm okay, and I'm going to do these things, or I'm going to cry, or I'm going to not do anything, but for today, it's okay.
So it's that gratitude, right?
Well, gratitude is another huge tool I use, huge. I mean, this is sort of like, I accept myself as I am today.
Right.
And I know that I'm going to be able to get through this. Like I have it's also self-love, which
self-love.
I didn't get a lot into that, but basically that's the self-compassion, the self-compassion and being grounded. I know I'm going to get through this. So
that's wonderful. Yeah. Thank you so much for sharing that.
I love these mantras. Like I love yours, Sherri's. I love what you added to it, Shalu. I love yours, Linda. And I will tell you, Shalu just alluded that I did run the Boston Marathon, and I will tell you that mantras are definitely what gets me through that race, and the training and everything. And I have many different mantras I could share, but one of them, one of my dear patients who I ran to honor this year, did share with me the night before. I was feeling a little down on myself because I had an injury and wasn't really sure how the day was going to go. And she was like, I will share with you what I tell myself, that I can do this and I get to do this. And I kind of internalized that. and went into it the next morning saying, okay, my Achilles tendon may act up. It is what it is. I can still do this. I get to do this. What an honor. What a great opportunity to run this race for such an important cause. And so anyway, mantras are so powerful. So I would encourage everyone listening to this webinar, which are many of you, to think about a mantra that is meaningful to you, that will help you get through your day, whether it's one of the ones we shared or your own personal mantra. So Shalu, share one of yours with us that you love.
Oh my gosh. Oh, you'll have to give me a second. One of the things that I remember reading, it was from the Blue Zones. We're all in such a fast-paced sort of world, right? We have a gazillion things on our to-do list all the time. And, I remember reading, she said, life's too short. You might not be able to catch up because it may run past you because of all the things that we have and that it helps me feel grounded because it helps me to slow down. And it's true, right? We always have a million things to do. So that helps my day and my self-care. Yeah.
That's such a good one. I know, love all of these. So, so many, so awesome. So, I do have a question for all of you, including you, Shalu, and then we should open it up to Q&A for the participants who are with us. But I just saw a study that came out actually less than a week ago in JAMA Oncology, one of the premier medical journals. And it was actually a survey of over 10,000 cancer survivors in the United States, and asking, kind of trying to investigate how many of the American Cancer Society survivorship recommendations when it comes to nutrition and physical activity were these individuals adhering to. And I'm just going to list them. They were achieving a healthy body weight, not drinking alcohol, getting 3 to 4 servings of fruits and veggies into their diet each day. And then the question just asked, have you exercised in the past 30 days? So those were the 4 questions in this telephone-based survey. And we can debate the merits of this type of research, but this is what was published, okay? And the bottom line from this survey of 10,000 cancer survivors is only 4% of those surveyed adhere to those 4 guidelines that I just outlined. So it's a pretty low number. And so I'm curious, certainly from you, Shalu, but also from Sherri and Linda, how can we as an oncology community do a better job to provide education about the importance of adhering to these guidelines, which have been shown to improve, tolerance of therapy, health, well-being, outcome in certain cases. And I know I'm preaching to the choir here, but I'm really interested in your thoughts on this. I don't know if you want to take a first step, Shalu.
Yeah, I think education, of course, is powerful. And webinars like these are very powerful because I think a lot of times people are not even aware of the connection between what exercise, like what physical activity or stress management or, nutrition can do for their survivorship. So I think education is pivotal. And unfortunately, we are in Massachusetts, and I think we're very privileged here. Our patients are also, lucky to be in Massachusetts, where I think that it's sort of very forward thinking, and there are many platforms that people can have that education. I don't think that that's necessarily true in a lot of other states, but also in other countries. Just that lack of education, of not knowing the connection.
Definitely agree. I'm curious, Linda, what your thoughts are.
I have a lot of thoughts, but my number one thought, and this, I don't know how this really helps us, is that people have to be motivated. You have to be motivated to make change. And my experience is that very few people really are. And even those who get cancer are not necessarily motivated to make change in their lives. Like, I have a friend who got cancer and she was like, I just want to get through this. I'm going to get rid of it and I'm moving on with my life. And that's what she's done. Like, it's not part of her. She's not a cancer survivor. She had it and it's gone and she's done. So yeah, I don't know. How do we can't motivate people. People have to have that themselves. And I find that in the communities that I'm part of with you, Amy, and that you've created, that the people who participate are the ones who are motivated. They want to know more information. They want to apply that there's so much that it comes from within. So I
Yeah.
think we do our best to create a community and make the information available and offer our excitement about it and hope to inspire other people. Like that's the best we can do, is be good role models and offer the information.
Definitely, I agree with that. Yeah, I think, having the education and then the motivation for sure, because if you're around other people who are enacting all of that, right? Who are actually your role models, like you said. No, that's perfect. And you, Sherry?
Yeah, I similar to kind of where you were going with Linda. I think it's about access too. For me, when I kind of had this thought too of, oh, you get your surgery, your radiation, you get your medication. Hey, we'll see you in a year, and it's sort of just done. And I did, and it wasn't until Amy, you caught me at a point where I was like, I don't really know what to do with myself because I'm not really managing this from a self-control, weight issues, other things from the medication. And you pointed me to Shalu, which opened up a whole other dialogue that I just didn't realize was available to me until that was kind of a pivotal conversation that led to now, oh, okay, so there is something more that you should be doing. It isn't just about the surgery and the treatment and the medication. It's much more comprehensive. And so I didn't know that until then, that there was access to it. And just even hearing Linda, you talking about kind of where you are from 2018 to now gives me a sense of how things are going to go, because I'm 2.5 years into it. So I still am sort of in that 5 year, everybody sort of talks about the 5 year, so I don't know what that looks like afterwards, but I certainly want to stay connected to this group, hear what other people's experiences are. And so do people really know that they have access to that, or is it there's a disparity in what's available to people, or the physicians aren't telling them that? Because I kind of wonder, like, it's been a year since I've been interacting with the wellness center in Shalu. I don't want to be cut off for for insurance reasons or whatever, because I feel like I need this community to keep going and help me through these next stages. So I do think there's an element, Linda, that some people view it as one and done, but they also may not be educated in understanding that there are other things, other aspects that they may want to explore in their health. Because I certainly didn't know it until Amy, you and I had that conversation. I was basically breaking down in her office, by the way, everybody was having a moment, and she was there and just got me on a path. So I don't know if there are others who had similar circumstances, or whether they're sitting there struggling, kind of like I was a year ago. And then just knowing that there's a path to wellness, and that there's a whole wellness program that can support you. And I hope it keeps going. I do love the group, Shalu. I don't know if you're bringing that up, but I do appreciate a lot of what the group has to offer. So if you're talking about that, I can certainly resonate on anything that you're saying there. So hopefully that answers your question.
Yes, thank you. That was perfect. But yeah, do you want to, Amy, you want to field some of the questions so we have enough time?
Thank you guys for sharing your thoughts on that. I'm so, I just read the article myself, and so I'm like, we need to do a good job. At least we're starting with this webinar series, which will be awesome. So we do want participants, feel free to put a comment or question, whether in the chat box or the Q&A box, and we will do our best to address the question. There was a question regarding what were these American Cancer Society recommendations that were assessed in this study. And so I kind of tried to type them up real quick and put them in the chat, but they were very basic things that we certainly talk about in oncology clinic, which I'm sorry, there's a noise outside my house. This is real life. But it was really, the question was, have you exercised in the past 30 days? So it wasn't really getting into the details, where we recommend at least 150 minutes of moderate aerobic activity each week, along with strength training at least twice a week. And we're happy to talk a little bit more about that. That would be what I would talk about for exercise. But they just asked, have you exercised in 30 days? Have you had any alcohol in the past 30 days? Adequate servings of fruits and veggies, which was really in the survey, really about 4 total. And then finally, are you at a healthy body weight? So it was very basic questions that they looked at in this database, which was really based on some data acquired by the CDC through some telephone surveys. So anyway, there is a question from one of our participants saying finding some difficulty finding support given a diagnosis of leukemia. And I do want to say, I understand, there's a lot more data in some types of cancer, such as breast cancer, that we've talked a lot about today, about the benefits of these lifestyle factors, and maybe not as much in other cancer types. But our lifestyle medicine program at our cancer center, really, we serve all patients with all diagnoses, ranging from breast cancer, prostate cancer, colon cancer, hematologic malignancies. So for patients at MGH, we'd be happy to see you for a one-on-one consultation or in our group medical visits. The Leukemia and Lymphoma Society does have lots of evidence-based information on their website for individuals who've undergone treatment for leukemia and lymphoma. So we would definitely refer you to that site as well. Dr. Ramchandani has also kindly put a link in the chat to our lifestyle medicine site, which does have information about our clinic as well as the upcoming webinars. Did you want to comment further, Shalu?
Yeah, no, all I was going to add to that was, yeah, so definitely I think the lifestyle medicine team has obviously individual consultations as well, that anyone with cancer can become a part of. And then as Dr. Amy Comander also mentioned, there's the paving group, actually maybe Linda mentioned that earlier, how she had done the paving group with Amy, and that is an option as well for, I want to say that's only for your breast cancer survivors, right, Amy?
So, great question. So paving the path to wellness is for individuals with a diagnosis of breast cancer. That is correct. I will say, and I want to hear about your groups in a second too, Lauren Winters and Carol Sullivan have developed a group visit program within lifestyle medicine for patients with any type of cancer. So the person who posted that she has a history of leukemia, she could be in that group. So individuals with any cancer diagnosis can be part of that lifestyle medicine group visit. You just need to ask your doctor or APP to put in that referral. And then Shalu, tell us about your group visits that you've been offering that Sherri's part of.
Absolutely. Yeah. So at the, I mentioned earlier, I work at the Mind Body Medicine Institute at MGH, and through that clinic, I am offering group visits for weight management. And again, in these visits, we do go over generally the principles of lifestyle medicine as well, but with the focus on weight management and what helps with weight maintenance. And if you were interested in that, I can put the number down in our website for the Benson Henry Institute for Mind Body Medicine as well.
Ooh, I do want to also mention the Benson Henry Institute for Mind Body Medicine also offers a program for cancer survivors focused on stress management and resiliency training. And there's information on the Benson Henry website about that too. And it's another excellent program that really focuses on stress management strategies that Shalu really outlined are also so important as we think about this concept of goal setting. So thank you for putting that in the chat as well. That's awesome.
Yeah, so that's the last link I put in there. That's for the for cancer survivors. There is a program for stress management and.
Thank you. And I just have to highlight another mantra that's in our chat that I love. Yesterday is
Not seeing
history.
the links.
Tomorrow is a mystery. Today is the present. Love that. It is a gift.
Amy, you cut out a little bit. Can you repeat that? I didn't hear that.
I'm sorry. And there is some activity in my backyard right now, but the links, we will repost the links to make sure everyone can access those.
Okay, yeah, because I'm not, yeah, I thought can everyone else see the links? Yeah, okay. Ooh, other people cannot see the links either. That's.
I think we need to direct them to everyone when you put them in the chat. So guys, we're all learning together. That's a goal. So yeah, we can repost them so they go to
everyone. Yeah.
So and there's another comment about
we'll have to send this. I apologize. Yeah, I don't seem to. Okay, so they can't see the links. Maybe, Amy, can you hear me? I wonder if, because the chat that I have, I could only post to the host and the panelists, it seems. I'm not able
I'm
to.
gonna repost those links, just because it's a little bit
Okay.
noisy back here. I'm gonna let you guys keep chatting, so I'm gonna put them in
Okay.
right now.
Okay, that's fine. All right, perfect. Yeah, so there's 3 links in there, and then I'm gonna just read this one of the message. Happy to be here. I'm forward to learning more about your clinic. So most of these groups are they're all Zoom. Yeah, at least ours is, and the paving is as well. Okay, that's great. Yeah, so if you were interested in the groups, for one of the participants who had messaged, they're definitely via Zoom. Dr. Comander is going to post is on the and find an appointment Lifestyle Medicine Center. The team at the other link institute.org, where we have the weight management groups. Okay, great. I think those were all the questions. In the right above, in the area where you type, you can, oh, okay,
I
that's
just put
somebody
that in
answering
the
to me.
chat. I hope that worked. But again, Benson Henry Institute for Mind Body Medicine, and then Mass General Cancer Center and Lifestyle Medicine. Our site will have links to all of those things. And again, your healthcare team should also be able to provide education about these great resources at the MGH Cancer Center too. So I do also just want to acknowledge that we have a webinar series going on through June, and our next one is in 1 week, where we're going to really focus on bone health, which is such an important topic for so many individuals. No matter what your cancer diagnosis might be, so many of our treatments can unfortunately cause accelerated bone loss. And our bone density, bone is an organ. I always tell my patients, that's an organ just like your liver and your heart and your brain, and we need to keep the bone healthy just like every other part of our body. So I'm thrilled that some of our colleagues are going to discuss this next week.
Yes, so these are going to be recorded, and you will definitely have access to them if you're not able to make it next Wednesday. And you'll be able to find them on the website, on the MGH Cancer Center website. That was on one of the links. Yeah. So I just want to thank, Sherri and Linda so much for your time, for sharing all your tips and everything. That's been so helpful to hear from both of you. So thank you.
Well, it's a pleasure. Thank
And
you.
thanks to all who joined us today, and we hope you'll come back for the next talks, because they're all going to be great. So, and we appreciate any feedback you have too. Thank you so much and have a great day.
Thank you all.
Bye.